Your palatal expander was made with the latest and most advanced in digital technology. No squishy moles needed, only that precise digital scan that was done at your first visit. This scan uploaded to a special laboratory and was used to print a 3D model of your teeth and jaw, upon which the metal palatal expander was then printed. It's easy and comfortable to place on your teeth, and even though it may feel a little different at first, don't worry, you'll get used to it in a few days. As a reminder, the palatal expander's purpose is to widen the narrow upper jaw so that it fits properly with the lower jaw. The expansion will also create some space for some unerupted permanent teeth that are currently not in good positions to erupt into the mouth. You'll be making turns on the palatal expander once a day until enough widening has been accomplished. This usually takes about 3 to 4 weeks. We will check how the turns are proceeding in 2 weeks to help determine how much more turning is needed. After the widening is complete, the expander is required to remain in place for 6 months to allow the new bone to stabilize so that when it's removed, voila, we have a new, better fitting upper jaw. Some patients may have been prescribed to use a headgear after the turns are completed to help move the upper jaw forward before it sets into position. When turning at home, you want to make sure that both you and your child are in comfortable positions. Many parents tell us that to position the child laying on a floor, a bed, or in a chair with a low back so they could tip their head back. Make sure that the head is tipped up and back enough so that there is enough light for you to see clearly. If you wear glasses for up close, this would be a good time to use them. The expander spans across the roof of the mouth. In the middle, there is a hole facing you, which is one of 4 holes that are perpendicular to each other in the screw cylinder which you are turning. Even though we speak of the top jaw as one bone, it's actually made of 2 halves that meet at a point called the suture, you've heard that word, in the middle, and this is where the widening takes place. Each turn of the palatal expander screw is actually 1/4 of a rotation of the screw, which is equal to 1/4 of a millimeter. Very small amount, about the thickness of a piece of paper. Not a lot, but in 4 weeks, it should achieve our goal for the amount of widening that is needed. When the first turn is made, you may feel nothing, or you may feel a gentle sensation on the roof of your mouth, the top back teeth, or maybe even the bridge of your nose. If you do, it usually goes away in about 20 minutes, so there is no need to take anything for it. Anything you feel with the first turn is the most of whatever you might feel. After 3 to 5 days of turns, patients should not feel much of anything during these turns. Each day as the turns are continued, you should expect that a space may open between the 2 front teeth. This is expected as half of the teeth are on one side and half are on the other, and it is a sign that you are doing a good job of making the turns. But don't worry, the space will close back on its own in a couple of months after we stop the turns, or we'll intentionally move the front teeth closer together if it was planned to place a small section of braces on the front teeth after the turns are completed. Lastly, you may feel like you have a lot of saliva in your mouth for a few days while your mouth is getting used to this new thing. Try not to spit on anyone while you're speaking. And don't avoid speaking. Talk as much as you do normally so that your mouth adjusts to the expander as quickly as possible. Eat slowly and cut foods into small pieces to start until your mouth is used to the expander. Now, let's review some instructions on how to make the turns. The expander key has 2 parts. The hard plastic handle, which you should hold with your thumb and index finger on the wide bottom, which should be facing down. And then we have the metal key pin, which swivels on the plastic handle. The metal pin has a step at the end, which limits how far it will insert into the hole, so you don't have to worry about it going too far. You will insert the offset pin into the expander hole with your thumb and forefinger grip on the plastic handle facing down. Tip the head back and insert the metal pin into the hole. It will be at about a 45-degree angle. It should almost be able to hang there by itself if inserted properly. Once the key is inserted, you should hold the handle from outside the mouth at that wide part, and you're going to tip the plastic handle up and then push straight back toward the back of the mouth to make the hole and the sideways expander screw turn. You know you have completed the turn when 2 things happen. You cannot turn any further, and 2, you'll want to clearly see the full next hole arrive so that you'll be able to insert the key and make the next turn. Lastly, remove the key from the hole towards the back of the mouth. It is important that the key is taken out of the hole towards the back of the mouth before trying to remove it, so that you're not undoing the turn that you just made while trying to remove the key. Starting tomorrow, you are going to make 1 turn each day. Most parents make the turn either in the morning, before school, or at night, before bed. It is recommended that you make it around the same time each day so that it is easy to remember. If you miss a turn, try not to do it. You'll need to make an additional turn next time. If you are having any difficulty making the turn or with inserting the key into the hole, don't worry, just call us and stop by and we'll straighten everything out for you. When the expander is removed in 7 to 9 months, most patients will be included in our complimentary orthodontic guidance program. That means they'll be checked every 6 months to monitor the growth of the teeth and jaws and to determine the best timing and strategy for any further recommended orthodontic care, or to start with their braces to get the alignment and bite of all the permanent teeth as best as possible. You will head now to our treatment area, and we will have the turning process reviewed with you once the expander is in place. Congratulations on your palatal expander. It's your first step for a healthy and attractive smile.